And new at 6, hundreds of people are left without a place to turn to after Hampton Roads lost its largest mental health care provider in 2021. The problem has only gotten worse over the last year and a half. People are waiting up to 6 months to get help because of an increased demand and dwindling workforce.
Sarah Hammond found out where you can find resources and what you can do on your own.
I think that I can't overstate how vital your mental health is.
Angel Bunton is a licensed clinical worker in Portsmouth. She spends her days working with people who have depression, anxiety, you name it. The problem is her schedule is packed, and she's not the only one.
They're booking appointments, as far as 3 weeks, and, some people are waiting months.
The World Health Organization estimates a 25% increase in people with anxiety and depression, and that research only considers the first year of the pandemic. With demand spiking, the few resources Virginia has to offer are filling up.
It is a real problem.
Kurt Hooks is the CEO of the Virginia Beach Psychiatric Center and also contributes to the state's relatively new Behavioral Health Commission. He says losing so much of the workforce in the last few years has had a huge effect on access.
It's difficult to understand where to go and how to navigate through the system.
But for some, a long wait time can be detrimental.
They haven't escalated to the point of crisis. They're waiting longer to see a provider, and they may be more likely then to escalate to the point of a higher level of a crisis.
While state and local lawmakers are working to find long-term solutions, Bunton says there are things you can do on your own to help while you wait to see a professional.
It's something that I call extreme self-care.
She says one option is practicing mindfulness, things like meditation, taking time for yourself, or if you want to go the extra mile, invest in crystal bowls like hers to take a sound bath. On a more basic level, Bunton says taking a longer walk, being in the sunshine for a little longer, and staying socially connected can make a big difference.
Isolation is a precursor to many mental health disorders.
Hook says from the state and national perspective, a larger emphasis is now being placed on boosting resources and recruiting staff. Bunton says if you aren't sure where to start to get in to see a professional, contact your local community services board. Both say while resources are limited at the moment, help is out there.
Please be persistent. Don't lose hope. It's more difficult than it's been, but it's certainly still possible to get the help you need.
Sarah Hammond, 13 News Now.
Hook says it's not all bad news. He says they're starting to see a small but noticeable increase in their workforce.